Welcome, everyone. We're going to go ahead and get started. Thanks so much for joining today's webinar called Nurses Inspiring Nurses, the Experiences of the ANHE Environmental Health Nurse Fellows. My name is Rachel Kerr, and I'm the Nurse Fellowship Coordinator for the Alliance of Nurses for Healthy Environments. Kara Cook, who also coordinates the fellowship program, among her other duties as Climate Change and Health Coordinator at ANHE, is on this call with me today running the tech side, so you may hear from her as well. Thanks, Kara, for your support. Just a few words about the ANHE Fellowship. 30 nurse fellows and 10 nurse mentors from across the USA, including Puerto Rico, participated in the inaugural ANHE Fellowship cohort in 2019 through 2020. The fellows learned about environmental health, justice, and equity, partnered with community-based organizations to conduct projects addressing community-identified environmental health needs, and educated their fellow health professionals about environmental health and justice. The inaugural fellowship was a resounding success and promoted health in communities across the USA, even in the face of the unusual challenges of the past few months. Today, we will hear from 3 of our nurse fellows about their fellowship work and experience. Before we get started, I have a few housekeeping items. We'll take questions at the end of the 3 presentations. You can enter questions into the chat box in the bottom left-hand corner of the screen. This webinar is being recorded, and the recording will be sent out to those who registered for the webinar. ANHE is offering 1 hour of nursing continuing education for viewing the webinar. In the follow-up email, you will receive a link to complete an evaluation and post-test after viewing the webinar. To receive nursing continuing education, you must complete the evaluation and post-test. With that, I'd like to introduce our first nurse fellow who will be speaking on today's webinar. David Buckheid is a registered nurse, BSN, from Missouri, who recently began travel nursing in Long Island, New York, and El Centro, California. Before studying nursing, David worked for nonprofit organizations in Kansas City, seeking to provide resources to communities in need. Through the ANHE Fellowship, David is actively participating in ANHE's mission to promote healthy people and healthy environments. And with that, David, you are welcome to begin.
Hi, thank you for the introduction, Rachel. So I titled mine Engaging Youth in Environmental Health in Kansas City, Kansas. Next slide, please. So here's a little outline. Let's talk about the process of selecting a community-based organization to work with, the reasons I worked with them, how we've developed the project together, how we got started, and then a little bit of analysis moving forward. And I want to define a term because I'll be using it a lot, environmental health. And the definition that I found for that was environmental impacts on human health. And next slide. So the first thing to do to get started on this was to build relationships and kind of gather information to assess what needed to be done and what kind of project would be feasible and impactful. And ANHE was really instrumental in setting it up, of course, because it's the ANHE Fellowship. But we had an in-person meeting in Philadelphia last June in 2019, and there was a lot of education at those in-person sessions, and all the fellows from across the country got to meet one another as well as the mentors. And I wanted to join the ANHE Fellowship because I'd always been passionate about environmental health and interested in the environment and interested in nursing. So it was just kind of 2 of my passions wrapped up into one. And Lynelle Phillips was the mentor for my region, and then Atanis Mena and Kylie Peter-Smith were the other ones. And the EPA Region 7's the Midwest. I believe it's Nebraska, Iowa, Missouri, and Kansas. And then I can kind of jump into the next slide here. The one-to-one meetings was kind of my main way of gathering information and it's based on the HEMA's principles for democratic organizing. That was a meeting back in the 90s in New Mexico, in HEMA's New Mexico. That was an environmental health sort of meeting, and they decided on some founding principles for including people and organizing from the bottom up, and just kind of how to do community organizing not in a top-down fashion. And there's definitely a risk for doing that, coming from an outside organization into a community, which is part of the reason we worked in our own communities. So this is a list of people that I interviewed from various environmental organizations, as well as community groups, health department, and I did some cold calling. I got some referrals from people. My mentor connected me to some of these folks, and it really kind of built up my knowledge base and prepared me for the rest of the fellowship and implementing the partnership. Next slide. Uh-oh, I think I've ended up.
Can you speak a bit, David? I can't hear you at the moment. I just want to
Yeah, are you still able to hear me? My webinar disconnected.
I can hear you.
I have the PowerPoint in front of me. If I can continue on the phone audio, I could just read off my PowerPoint without being officially in the meeting. It's not letting me reconnect.
Okay, and I just want to test and make sure our attendees are able to hear both me and David. Can someone just comment and let us know? Okay, awesome. So it sounds like we're good. And yes, you can continue on the phone, David. That should work just fine.
Okay, thank you.
You're welcome.
All right, always tech support issues with these meetings, but I'm happy that we have something figured out here. So the community partner that I ended up working with is called Groundwork NRG, and their mission statement was intertwined with environmental health. So I was confident that they would be a good one to partner with, and they're responsive. They answered emails. They were energized, and they had ongoing programming. And I knew that being part of a year-long fellowship, it would be hard to try to start something completely from scratch. So it was kind of a reasonable scope for the project to work with them. One of their programs was called the Learn to Earn program, and it involved a group of about 20 youth aged 12 to 16, and it was an annual program, and the students would receive a stipend for working on real-world situations through the Learn to Earn program. And I had experience in youth programming before, so it seems like a good fit to me. This is a map of Groundwork NRG's area. They were formerly known as HNMA until this year, and these are all the highlighted areas are neighborhoods that they're engaged with. And they're in Kansas, just on the other side of the border with Missouri. You can see the Missouri River on the map, of course. And I'll have a bigger map coming up, so kind of try to keep that slide in your frame of mind there. Some of the problems that are pretty common in urban areas, but especially in Kansas City, Kansas, are a history of redlining communities dating back to the 1930s, low home ownership, and that's something that Groundwork NRG had worked on in their heat report from 2018 with the unified government of Kansas City, Kansas, and other stakeholders. There's a tremendous amount of highways, railroads, airport, river freight in Kansas City, Kansas, even for an urban area. It's really high concentration. And there's also an industrial park, a motor plant, you name it, all kinds of industrial applications there. And there's older building stock, so there's a lot of lead and asbestos and hazardous materials to be found. And Kansas City, Kansas is a majority minority community and consistently ranks the lowest among Kansas counties in health outcomes. And this is the slide at the map of average age of death from 2010 to 2014. It's kind of bleak numbers, and I'm not saying that correlation and causation, I'm not saying that environmental health is the reason that people are living shorter in these communities, but in the northeast corner of the highlighted little areas is the area that HNMA is focused on, and you can see that the average age of death is under 70 for most of those areas. I believe those are zip codes. Let's see. So the program was kind of a two-pronged program, the ANHE and Groundwork NRG partnership. The first part was to be a photo voice program, and photo voice kind of puts the camera and the video camera in the hands of people, usually with little power, and the photo and video kind of speaks for itself, and people get on social media, and it kind of helps them build their movement or express their sorry, I'm losing my words here, but it's kind of a way for expression to raise awareness of problems. Black Lives Matter is a movement that is pretty successful in using photo voice. So we kind of got started also with the Walk Audit, and this is a way for people to document for the students to document their community. People might be familiar with broken window theory and the CEPTED, community crime prevention through environmental design, as a tool that people use to assess their lighting, sidewalks, curbs, neighborhood safety kind of things, whether street signs are posted where they're supposed to. So we were using this tool to focus on walkability and environmental health factors, immediate ones like the street signs, but also things like illegal dumping and littering, and whatever the students would kind of come into, because we wanted to leave a lot of the autonomy of the project to them and for them to roll out a social media campaign alongside it so that they could bring this to their community. So here's a few photos that I took from the Walk Audit. There's a photo on the left with a girl with like a fancy DSLR high-end camera that the organization was letting her use. And on the right, they're taking some pictures of some new sidewalks. And both of these photos are taken like right outside of the Groundwork NRG building that they occupy with some other not-for-profits. And then on the next slide, there's a photo of one of the sides of the Groundwork NRG building. And you can see that you might be able to see their doors knocked out. Somebody had vandalized their door. So that's definitely like a CEPTED issue, a classic thing that you would see in one of those reports. And this is across the street from Groundwork NRG. The building being renovated, and there's a big pile of metal that looks like it's going to be recycled and dumpster. And I had a conversation with the students at that point about how this job site looks pretty clean and pretty contained and relatively safe, but you don't really know how well and closely they're following protocols unless it's being enforced by the community. People have to take an interest in the construction and keep their legislators accountable, or these kind of sites can really have release a lot of toxins into the community. And the second aspect of the program for the youth development was to have speakers come in. And some of these people spoke and some of them didn't, but they were all confirmed speakers at the time. So we had ANHE speakers and Bike Walk KC, Clean Air Now. All these people come in and talk about their careers and how they got to be where they were. And it's a diverse group of organizations and people meant to inspire the kids into thinking about careers moving forward, and also to educate them about the given topic that they were an expert in. And The next slide is a timeline for the program. And you can see that it started in February, right before coronavirus started taking off. And then we got the spring break on March 18th, and that was the end of the in-person meetings. So the students had worked to the point of planning out a lot of how they would be tackling the photo voice, had a few guest speakers, and we just started taking the photos at the Walk Audit, and then no more in-person meetings. And the next slide. So it really interrupted the collaboration with ANHE. And then I went to New York to go nurse up there, and the Learn to Earn did continue in an online format. I attended a couple of those, and but I wasn't able to be involved like I had been before. So most of the collaboration was unfortunately not really continuing at that point. And there's community lockdown, so we didn't really want the kids going out and taking photos. They had reduced hours of meeting time because it's just harder to keep the kids engaged in the online format, as a lot of parents of children probably know. And then they did a collaboration with the U.S. Census, encouraging people to get counted in the census this year. They did a little, some social media spots on that. So here I have my works cited, and I just kind of concluding it was disappointing having the coronavirus throw everything off, just like everything else in our lives. And I think Groundwork NRG was a good partnership, and I'd like to continue working with them and ANHE in the future. And with that, I'll let the other presenters take it away. Thank you.
Thanks so much, David. It was great to hear about your experience in the fellowship and that partnership with the community-based organization. I am going to now introduce Sheila Stone. She's the nurse fellow for Region 3. And Sheila grew up in the 60s and 70s in Oakland and San Francisco, California, worked as a post-high school volunteer at the Hyde-Asbury Free Clinic, received a BSN from Humboldt State University in Arcata, California in 1985. She has practiced and taught public, community, and home health, first in the Northwest and then in the Blue Ridge Mountains of Virginia, where she has lived for 30 years. Sheila completed a master's in nursing education in 2018. She also plays fiddle and banjo and knows how to do flat foot clogging. And with that, I will turn it over to Sheila.
All right. I'm happy to see so many of the people on my support team on this call. That is very heartening. I have lived in Nelson County, Virginia, in the Blue Ridge Mountains between Charlottesville, Lynchburg, and Stanton for the last 20 some odd years. And I first connected with ANHE over the Atlantic Coast Pipeline. I thought I would be continuing that work with this fellowship, but it turned out very differently. I'm advancing a slide, but it's not advancing. Nope. Let's see. Okay. Our first meeting, and David talked about this too, was at a Quaker retreat center. And as a longtime meditator, I was so happy to attend the morning meditations each day. The first day, I asked for and received clear spiritual guidance on this fellowship during the morning meditation. I had what I would call a vision. During that first meditation, I saw the earth under the stress of climate change. I saw red for heat expanding, brown replacing green and blue, desert sands spreading, and I saw rivers of humanity walking across the earth. And I saw those rivers as the tears of God. I had already been working on immigration, but I really hadn't tied it together with climate change. And I also knew that other environmental organizations hadn't. In addition, the whole idea of home has always been really evocative for me personally. After all, I'm a home and community care nurse. So I'm trying to advance slides. Yay. CIRAC is the Charlottesville Area Immigrant Resource and Advocacy Coalition. And I've been a huge fan of theirs since I found out about them. So They're in Charlottesville, which is about 35 miles from me. After the retreat, I contacted them and I told them about this fellowship, and they were interested in expanding to Nelson County, which is where I live. And I felt like I could definitely facilitate that using connections from all the years of living and working here. And I told them about this thing about climate change and human migration, and they asked if I could make a fact sheet. So I said yes, and I started to search the literature, and I found really almost nothing that I could use to work from. I want to say that that's really changed in this last 1 year, but anyway. I clicked, there it is, okay. So in my first literature search, I found only one article in the nursing literature regarding environmental damage and human migration and connecting that with nursing. When I expanded the search terms, I expanded the literature that was related, but it was really scattered through a lot of different disciplines, and a lot of it was very technical. I did not have a research librarian to help, and had I known how intense this research was going to be, I would definitely have tried to get one involved. But meanwhile, I made do with my at-home assistants. No, I'm not answering that. The more I looked, the more implications I discovered. Next slide, if it's not, yeah. So it turns out the books were being published on the topic, and the first 2 books that I read on this topic, which I gleaned from references in the literature search, became available in May and July of 2020. During July, I took a long-planned month-long vacation. I went back to Seattle to consider moving back home where I'm from. I took these 2 books with me, and I kind of took them with me waiting at buses and in coffee houses and sitting on beaches. And the implications of what I was finding out were really horrifying. Often I could only read a few pages at a time. There was so much evidence of mass displacement and mass suffering that was directly and indirectly related to climate change and to ineffective or worse responses to it. And it was hard to take. I did a whole lot of other education activities. It was very clear that I was not going to be able to get a full picture just from written sources. I was determined not to spread information that wasn't true, and also not to take credit for work that was already being done by someone else. And in that process, I became quite a networker, and I made up a email support team of experts and supportive friends. I went to a couple of conferences on refugees. I did some webinars, and I did some interviews with stakeholders and experts. I found a lot of people who were kind of what I feel like were my people. And the deeper I went, the more that intellectual, psychological, social, and spiritual support became essential. So getting the information, it took me, maybe until about December to feel like I had enough information to write a decent fact sheet. But getting the information out turned out to be even more challenging. I did not know how to write for publication. I have no graphic design skills. I couldn't sort. I couldn't prioritize the massive material I had. I ended up hiring an editor who's on the call, and a graphic designer who's been helping me with stuff. So what I'm going to do now is just share a couple of slides from what ended up being a PowerPoint presentation. And like David, I didn't get to present it, and I'll explain how that happened. Okay. So the current version of my educational presentation is divided into 3 parts. The first part is how climate change and human migration are connected. The second part is some policy stuff, how we got here, how we might get out, what it might take. And the third part is implications for healthcare. So This is just a sample of some of the work that I've done. And let's see, there's a lot of climate-related factors that are part of human migration, including agriculture, hunger, violence related to resource scarcity, water safety, infectious disease, weather events and disasters, floods, sea level rise, changes in animal and plant distributions, increasing urbanization, meaning increased need for energy resources, wildfires, and so much more. So I have this little 2.5-minute clip that's I just think is beautiful, and it summarizes some things kind of quicker than I could. So go ahead and play that. Maybe.
Cosechaban, de eso se vivía aquí, solo de la agricultura. Que cosechaba para el año. Otros años fue normal, llovía. Hoy no llueve. Llueve solo para sembrar y llega la planta así y se seca de tanto verano.
There are many reasons for migration, but climate change is becoming one of the main reasons.
¿Cómo se arruinaron los cafetales? La gente los apodó. Estos palos, ¿qué le corta a uno? Nada. No hay. No tiene nada, necesitaban. Miren, secando.
What's very ironic is that those who have contributed the least are the ones paying the highest prices.
Mire, como no llovió, no pegó.
Ay, mamá, ¿pero qué hacemos con esta pobreza? Dijo, váyate en esos cafetales, dijo, vas a ver cómo están los cafetales. Palos están secos, dijo, y palos que tienen hoja, pero las hojas están caídas del verano.
We do have breaking news, though, we want to get to.
A teenager in federal custody has died. The cause of death for the 16-year-old Guatemalan under investigation this evening.
¿Qué hacemos en este año? No vamos a hallar trabajo. Entonces me dijo, al ir a trabajar en Estados Unidos, me dijo, aunque no lo voy a mandar bastante, dijo, pero no sé si en que sea lo mando para su maíz y en que sea la sal. Bueno, di mi corazón que se fuera, pero no sabía cómo iba a venir.
Perfect. And back to. Then there's I have a couple images in the slideshow that also, there's a fair amount of images in my longer PowerPoint. The 2017 image on the left and the accompanying article and discussion are widely referenced in scholarly and public literature. It's an overlay of human global migration and climate affected hotspots. And most of the scholars on climate migration agree, and you'll see that this is the global south, right? The slide on the right is from the first article in a series from the New York Times that came out last week. So that's July 23rd. So I'm finally in the mainstream. And this is a model of one predicted future with, it represents potential 25-year growth in trapped populations because of hardened borders. Okay. Clicking, yes. Section 2 is about policy and humanitarian response to this crisis. So when I envisioned this presentation, this slide is accompanied by handout, a terminology handout and definitions. When I started, these were just some of the terms I did not clearly understand. And clarifying them has been an incredibly complicated and educational process. This one is just making the point that people moving due to climate change are not moving from the countries most responsible for it. Another point that I want to make is that resources in the global West and North, how they're deployed in working with climate change was an eye-opener. Oh no. Section 3 is on health issues related to climate-mediated human migration. So this slide is from the CDC. This is where I start talking about healthcare implications. And again, part of this is just to some of the push factors that lead to human migration. These effects of climate change are happening somewhat here, not hugely, but much, much stronger and faster in other places. I also have a slide on selected migrant health issues, and that comes from some of the interviews that I did and some personal experience. It's not a complete list. It's sort of to give, again, a face. And it's also meant to arouse compassion and combat some of the prevalent stereotypes about immigrants. Most of us work with migrants if we work in the healthcare system as patients, clients, and our teammates. And one of the points I want to be making is that a migrant competent healthcare system, migrant inclusive healthcare system, needs to be part of adaptation planning. This is an event that I set up so that we could volunteer in one of the ICE detention centers. And so I was able to volunteer there for several months until the detention center closed down. And also this was part of like getting a nucleus of people in Nelson County who might be interested in joining with CIRAC. CIRAC, well, it's complicated, all the different organizations that work together. But anyway, CIRAC was part of this training. I can't let this slide go without saying that Farmville is currently at 90% positive for COVID-19. And these were people I spoke with and heard their stories. Like David, I also did a climate change movie series in my local community center. Our first movie was March 1st, and then we stopped. So much for the local recruitment right now. A couple other things didn't happen also. And then this, if it shows, I find this evocative. It's besides leaving one's home, there's this whole piece about sociocultural and religious practice. A lot of religions are just really based, like the rituals don't have the meaning if they're not done in the place where they're supposed to be done. Okay. So don't try to read this. This and the next page are available from ANHE and will be included in the follow-up email. I feel like I could do an entire webinar just on a tour through these websites. These are the ones that I felt were the most current and credible, but this field is changing. So there's also a book list, and you'll get that. Lancet has a section on climate change, but as far as I know, I don't know if there are other journals, and I'm looking for suggestions. I learned a few things. The main one was it was impossible to be as active with my CBO as I'd intended because it's just too hard for me to get to Charlottesville. And because of the work that I've done with this fellowship, it's really clear to me that rural is different than urban. So there were quite a few lessons learned, but I'm not going to get into all of them. I want to I still want to keep working on this presentation and offer it to groups and get feedback on how to improve it. And then once I've done that, facilitate brainstorming sessions. That was the original plan. I also want to thank Annie, my wonderful Region 3 team, my wonderful mentor, and Ruth McDermott Levy, and also a bunch of other mentors and mentees and fellows that once they figured out what I was doing, started sending me stuff. And last, my wonderful email support and collaboration team. So stay tuned. Thanks for listening. I'll be around for the Q&A. That's my contact information down there. That's it.
Thanks so much, Sheila. Super great to hear about your important work around the connections between human migration and climate change. So thanks again. And with that, I'm going to introduce our final presenter. Erica Alfaro Lemus is a public health nurse case manager with California Children's Service, CCS. Erica has worked in a variety of acute care settings since the age of 18, when she began her career as a nursing assistant. She has volunteered with nonprofits in Sacramento and the San Francisco Bay Area, and has recently been learning how to become a better advocate with her clients around the environmental health issues that affect them. Erica's leadership roles include being the immediate past president of the San Francisco Spanish Bilingual Toastmasters Club and now area director, and she's part of the National Association of Hispanic Nurses Equity, Diversity, and Inclusion Committee. And with that, I will hand it over to Erica.
Thank you, Rachel. Well, now I want to invite everybody to actually stand up and take a quick stretch, close your eyes, do a little wiggle. I know that this is a lot of information for some of us. I know that there's some new people who have not been part of the ANHE process. So nonetheless, I invite you to take big deep breaths, move around. Again, as our new reality has changed to the point where we're always online and always in front of a computer, it is very important for us to take care of ourselves. And as I like to remind myself, and I remind you all, that this is not a sprint. This is a marathon. Fighting for social, racial, and environmental justice is definitely not a sprint. It is a marathon. So I do invite you to move around. And as you are all finishing up or still moving around, which is completely fine, I want you to for all of you to imagine yourselves in a gorgeous beach, somewhere relaxing, just enjoying the fresh air, really just being one with nature. And I know some of you may be having a little bit of anxiety around the fact that, oh, we had to cancel all these summer plans because of COVID. But nonetheless, you're here right now and you're really present, and I just keep telling myself how wonderful it is to just even feel and to be alive. Now, as relaxed as some of you may be, I remember myself being in the Galapagos about a year and a half ago, walking with my friend, and my friend is an environmental scientist, so I got the 411 on what was happening in the island. But then she said, come here. And pretty soon we started picking little things all around this gorgeous, pristine beach, which initially I thought was pristine and beautiful. But then realized that there was these things called nurdles. There were cigarette butts, GoPro pieces. I mean, you name it. There was a lot of little trash. And honestly, at this moment, I started reflecting, I'm supposed to be in this gorgeous, beautiful place, right? And then I started thinking, well, what does this mean for larger metropolitan areas? I live in San Francisco. What does this mean for other places? And honestly, I started going through a whirlwind of, what does this mean for our health and for the people around us? Then I thought about the local fisherman who was being affected by the fish that would consume these little items and what that would mean for their family. I started thinking about how we just use plastic so readily and we just forget about it. And initially the reason I'm sharing this right now is because this was kind of the catalyst that got me to, first of all, not sleep very well, because I was constantly thinking about just how much plastic, and essentially plastic does come from fossil fuels, and how prevalent these things are. And essentially even the way in which, as I've learned within our fellowship, that just how terrible fracking and all the chemicals are for us as just like humans and as our health. Today, I'm going to be very quickly talking about climate change for those of you who may not be super well versed. And again, this is going to be the quick and dirty version. And I'm going to talk about how climate change affects our health, although some of the things that my previous fellows have mentioned have been highlighted already. How climate change can affect the most impacted populations, which are vulnerable populations, or immigrant populations, like Sheila was mentioning. And I'm going to talk a little bit about my experience as an ANHE fellow, and of course, how you as nurses should all get involved if you are not already involved. So very quickly, according to the CDC, climate change, of course, is not just about climate, right? It is a major public health emergency. And this is something that I like to say, COVID is the immediate issue right now. However, it has just been augmenting some of the already pre-existing issues that we have. This chart, I remember staring at it and really trying to go back to my high school, college education on the matter. But at the end of the day, the way I look at this is I like to imagine a human being being wrapped by a blanket and not being able to release some of that heat. And so, as we know, some of the CO2, some of the methane stays in the air for a really long time and trapping air that's really, really hot. And just like some of us, I know that I don't like to be contained in a blanket. So again, I like to think about it that way. I know that for a while the greenhouse gas effect was not something that we usually think about, but this was a very wonderful graphic that just reminded me of what our Earth is going through at the moment. One of the things that, well, a few of the things, right? I started thinking about just big picture. What are everyday things that contribute to the problem? As all of you know, our dependence on fossil fuels, uh, everything, at least for me, just making these connections, right? That every time we order something from Amazon, it's been driven in a truck, in a car. Our love for those juicy burgers, growing cows, that's extreme. That that's all. It takes a lot of energy to grow. One of the things that was really concerning to me was that, at least according to the New England Journal of Medicine, healthcare produces a total of 10% of greenhouse gas emissions in the US, which was very alarming to me. And I know that some of you out there are here for that reason as well, right? That some of the things that we're doing are not part of the solution, but rather a part of the problem as well, as much as healthcare has been a wonderful thing for many people. And one of the things that I kept thinking, like, oh, goodness gracious, I am wearing plastic. All of my clothing, there's some sort of synthetic material in there that again, it was made it's made with plastic. Fuels for heating and electricity, also flying, although Now we could say that we're not flying as much, but nonetheless, it was something that it definitely made me reflect on. Something that was previously mentioned by Sheila. Again, thank you, Sheila, for highlighting this. This is a very important graphic, in my opinion, and this you can find on the CDC website. It's a very comprehensive. As you can see, it just talks about just how climate is not only just affecting us, how we feel heat-wise, but really it does affect air pollution. It affects, again, just I start thinking like, oh goodness gracious, what if one day we did have malaria in the States? Which I really do hope that we don't. But if that is the case, that is really scary. Increasing allergens, water quality impacts, like water, food supply impacts. Again, like Sheila had mentioned so nicely about the forced migration, extreme heat, mental health issues, and these are all very interconnected. And of course, we always have to think about just how are most people affected. And I guess I had how are the most vulnerable people affected, right? We have to. It made me also reflect on the people that I was working with. There's again there's Black, Indigenous, and people of color communities, and for a while I had we just don't think about the Indigenous. At least for me, I shouldn't say we. I should say I for the longest time was not thinking about the Indigenous community that has been very underserved for a really long time. Obviously, there's low-income communities, people with limited resources. I started thinking about my immigrant and my Spanish-speaking clients, and of course, we're all part of these stories that a lot of our patients and our clients are able to share with us. And of course, I think of one of my heroes, which through the ANHE Fellowship, we were able to meet in person, and this is Zulene, whose community was across the Cavada incinerator located in Chester, which is outside of Philadelphia, and just thinking about how certain communities are affected more just because of the location of where they live. And then in thinking about the ban on plastics, that we're not shipping them to other places. Not saying that was a good thing that we were doing that, but that's happening, and that tends to happen where people who have very limited resources and who are contributing very little to the impact are being severely impacted by climate change. And then, of course, how can I not think about San Francisco and the people that I've worked around with? I worked in the mission for a while and for a nonprofit, and I thought about the families who have to work 2 to 3 jobs and who essentially are being affected by not being able to work, and the socio-emotional effects on young children, which I saw on a day-to-day basis when I did work with this community. And then just thinking about how unfair and how just certain people just don't have the resources and are ultimately being affected through these health disparities. And of course, I invite you to think about your hometown. Who are these people at risk where you work and where you live? Where are these areas? Who lives there? And this is, I invite you all to utilize the chat to type in who are these people, and if you're able to chat, and just, this is the part that requires some participation on people's end, if you're willing to participate, but just how are people affected? And again, these problems exist everywhere. But I do want to mention that we are extremely resilient. That's one of the things I keep reminding myself every time I have worked with my families. It's crazy how people just manage to make things work. And that's one of the things that I want to highlight and I want to remind people about is that people are very resilient. We as nurses are very resilient. We are problem solvers. And again, this is something that with ANHE, I've really appreciated the skill set and the resources, and I've loved how ANHE has been very well connected to community-based organizations that are really doing the work, and that has been very inspiring. Now, as for my experience as an ANHE fellow, I unfortunately, like most of us, we were very much affected by COVID and unable to finish some of our work. But on my end, I had the experience where I reached out to my current workplace. I reached out to leadership, and I was connected with the director of family health, who I outlined what I wanted to do. She kindly connected me to policy and planning. I connected myself with Office of Sustainability, found out that they had a climate change initiative. I connected with the Government Alliance for Race and Equity, as I realized how much of these climate issues are due to race and equity issues as well. My lovely mentor Barbara had took me to a meeting with her, with another nonprofit organization, and with the city of San Francisco. I attended a lot of meetings and even one with health officers in California, which was amazing. And yeah, it's obviously a work in progress. So I thank you all, and I believe I'm coming up to the end, and I wanted to discuss solutions, but of course, this information will be sent over to you all. And yeah, these are some of this is a running list that I have realized for any of us who want to do little things here and there, and who, again, if we start sharing this information to people, to the nurses around us, not only is it about picking one thing and sticking with it, but really, as nurses, how we can go ahead and start disseminating this information and really starting to empower the people around us that we love, our patients, our communities, so they really can thrive and be healthy. And again, I invite you to find your own catalyst and become a resource to those in your workplace and in your community, and really to continue this wonderful work that it's a everlasting work. Thank you so much.
Thanks so much, Erica. It's great to hear about your work and experience in the Bay Area and talk a little bit about climate change and its health impacts. I am going to now open it up for questions. If you can go into the chat box in the lower left corner and type any questions you have, and we will discuss them. And while we're waiting for questions to come through, I'm just going to mention some of the people who are most at risk that folks mentioned when you asked that question, Erica. Ricky Peck mentioned those living in lower income areas. Lois Wessel said, my patients are all refugees and immigrants and often come to the US because there's no food or because of other issues related to climate change in their countries of origin. That relates to what Sheila was talking about. Patricia Van Manen said Latinx and Native American communities in my area of Phoenix. They live in areas with factories by highways where exhaust builds near housing communities. Lee Williams says BIPOC and the unhoused. And Barbara Sattler mentions farm workers in her community, which is a rural and agricultural area, and that those farm workers are at risk for hyperthermia associated with expanded extreme heat days from climate change. So Tom Engel has a question. He asks, did either of the three of you cross paths with an elected official who now will do something legislative regarding climate mitigation?
This is Sheila, and I can speak a little bit to that, that I work with people who are running for office. And what I would love to do more. What I heard very clearly from one of the agencies that was going to help me with this is that elected officials want very specific bills that they can patron or champion or advance, and I was not at that point at that time.
Thanks, Sheila. And Erica and David, just speak up if you have encountered what Tom Engel was discussing, crossing paths with elected officials.
Hi, Tom. This is David. Hang on, we got an echo. Let's see if I can fix it. I know that I spoke to my local representative for the city of Kansas City, Missouri, where I normally live, and I found throughout the fellowship that there's likely some opportunities for me to participate in like the Climate Action Board for Kansas City, Missouri, because it's been inactive for a while and there's a lot of opportunity for people to participate there. But I didn't get any strong commitments from my legislators on any climate change agenda. But I know that my mentor, Linnell, was working on that in Jefferson City, Missouri.
Awesome. Thanks, David. And Erica, if you haven't answered that question, feel free to speak up. Otherwise, I will move on to the next question.
Yeah, it's been rather disappointing that, well, I mean, with everything that's been happening with COVID, yeah, a lot of places are doing everything prepackaged, and it's been very disappointing to just see how, again, and rightfully so with all, people's fear, but yeah, just the increase in use of plastic and the reusables, people walking around with the gloves as well has been really really upsetting. But I'm really hoping that as we're learning more about COVID, that people will start going back to just washing their hands with plain soap and water. But yeah, it's thank you for that question, Nancy.
Thanks, Erica. And Katie Carey has a question here. She asks, did most of the fellows select their CBO ahead of time, or was that developed after they were accepted to the fellowship with the assistance of their assigned mentors? And I can speak to this question, but I'm going to let the fellows address it.
This is Sheila. No, because I didn't know what my topic was going to be until after we started.
So you established that partnership after the fellowship began, right, Sheila?
Correct. I was already working with them, but not as a ANHE fellow. I mean, I was already like showing up at some of their events and, and following them on Facebook, and but I didn't have like an official relationship, which it became pretty unofficial anyway as this whole thing progressed.
Great, thank you, Sheila. I'm going to move now to Nancy Cheney's question. She asks, Erica, what's happening in your area regarding inability to use reusable water bottles or reusable shopping containers, etc., now due to fear over the COVID-19 contagion?
Oh, for some reason I thought I had already addressed that question, but yeah, no, people are still slowly phasing out the. I would say that there are some places that are allowing your own bags, but there's still a lot of containers that are like for instance, I used to shop at this kind of small co-op, and everything was bulk, and now everything from that bulk place is being packaged because of people touching things and all of that. But again, I'm hoping that that will eventually be phased out, and we will go back to really trying to minimize plastic, or trying to figure out an alternative that will not be as as ubiquitous as plastic packaging.
Great, thank you, Erica. And Patricia Van Manen has a really big question. She says, Tom's question is good. How can we collectively move policy on any of your projects forward?
Oh, I have answers. This was the question I was expecting to get, so I actually wrote an answer. This is Sheila. So the first one is to educate yourself using those resources that I'm sending, so that when you advocate, you don't advocate for things that have unintended negative consequences. Things to consider are the carrying capacity of places that we are thinking people ought to remain in. And again, educate yourself about where our money and our resources are going now. Secondly, advocate within your spheres of influence. I talked a little about the migrant-friendly healthcare system as a part of climate adaptation. That's going to be politically very difficult. But also, I heard a bunch of stories about icky things that happened to people with accents in healthcare settings. So that's a little thing that you could fix right there in your place. My plan had to do with the presenting and then brainstorming. So my plan didn't get to happen yet, and I'm looking seriously for places to present and brainstorm.
Wonderful. Thank you, Sheila. And I'm just curious if...
I think as nurses in the fellowship, it, for me personally, gave me a pretty good platform to talk about nursing and environmental health. And before that, I'd been a little bit shy about talking to my coworkers about nursing and environmental health. But as I came out of it, I felt much more empowered. And I think there's a lot of interest that I noted with my colleagues in like setting up local ANHE chapters or getting more involved with it. So I referred people to ANHE resources, and I think that was a concrete way of moving the cause forward.
Awesome. Thank you, David. And just want to acknowledge that we are running up. We're out of time here. We're about 4 minutes over. And I don't see any additional questions. There's one more question. Do you also get involved with environmental rallies showing that many nurses feel strongly about the environment? And I can definitely say yes to that question as a staff member, and doing activism work myself. And I know many ANHE nurses attend rallies and marches, and want to open it up to our presenters if they have comments about that, and then we will wrap up.
So this is Sheila, and I definitely show up at protests and rallies, and I wanted to do something more because I don't feel like I'm significant as a nurse voice just shouting. So that was the entire point of applying for the ANHE Fellowship for me, and it has totally worked.
Great. Thank you so much, Sheila. And we're going to wrap up now. Thanks so much to our attendees for joining us today and hearing about our fellows' efforts and experiences. And thank you to our amazing fellows for sharing your stories with us. And everyone, please be on the lookout for a follow-up email from us in the coming days with the recording, the post-test and evaluation, as well as resources and speaker slides from this webinar. So thanks again, everyone, and have a good evening. Goodbye.